Well, the war in Sudan has also triggered what the UN has described as the largest and most devastating displacement, humanitarian, and protection crisis in the world today. Now, for a small preview of the scale, over 2/3 of the population are in need of health, food, or other forms of immediate humanitarian support, while millions are facing emergency levels of food insecurity. So for more on this humanitarian angle, Jean-Nicolas Armstrong Dangelser joins us on the program. He is Doctors Without Borders, head of the Sudan mission. Thank you very much for joining us today. So can you tell us what kind of work Doctors Without Borders is able to carry out in the capital and in Sudan in general as these hostilities continue?
Yes, as Doctors Without Borders, we are having several activities in hospitals. We are also in communities through mobile clinics, and we are doing also work that is outside of the medical, strictly the medical lens, also through water and sanitation provision, for example, or even food distribution, as we really have to have a large scope of activities with the devastating humanitarian situation that is happening in the country.
I mean, the scale of this crisis, as I said earlier, is huge, unimaginable. I know it's hard to summarize, but what are your biggest concerns, the most urgent concerns as far as the humanitarian situation goes? And then similarly, what are the priorities then?
There is a clear high rate of malnutrition across the country. We are seeing that in many localities in the capital city, Khartoum. We also see that in large spend of the country in Darfur, in Zamzam camp, for example, where we had to unfortunately suspend our activities after violence, that our team could no longer stay there. The health system also completely collapsed in many parts of the country, including Darfur, Kordofans, and the capital city. So rebuilding that healthcare system, not just infrastructure, but also reviving it through having again medical teams on the ground, having again medicine and medical supplies are of utmost importance.
Jean-Nicolas, are you under the impression that either of these two warring factions, either the Sudanese military or the paramilitary RSF, is more likely to target humanitarian organizations or humanitarian operations in general?
We did have a lot of security incidents in areas controlled by rapid support forces, and it's extremely complicated to work in those areas. But we also have instances of indiscriminate bombing and shelling by the Sudan armed forces. So it's extremely complicated in many instances to work and to access the populations. Sometimes it's because of the security situation, but sometimes it's also because of administrative hurdles that we see, or because of governance collapse that we also have a hard time to access the most vulnerable.
So what impact do you think that these latest developments in the capital will have on the humanitarian situation?
We do have now access to some areas that we were not able to access before. So now we have teams that are in Bari, in the north of Khartoum, as well as Sharganil in the east of the capital, which was just under the control of the Sudan armed forces throughout the months of February. So we do have an increased access to some very vulnerable population. What we also see is that populations are returning to those places where there is nearly no more public services available, and where the healthcare system is completely collapsed. So there will be a lot to be done there, and the needs is going to continue to grow as the population will shift again from areas they previously moved and areas that they are now returning. So it will increase the needs as well.
Has your work been directly affected by the Trump administration's cuts to USAID? And if so, on a very concrete level, how has that impacted the work and the situation that you see there?
So our funding is completely independent. So as Doctors Without Borders, it didn't impact our funding, but it did directly impact our work because there is many um, healthcare centers, many activities around us that were run by other organizations that unfortunately had to stop. We are talking about medical care, we are talking about some food distribution, about some water supply, and we unfortunately we have to step in to a lot of instances to make sure that we are not fully impacted in our own work, but obviously the gap that is left behind by the US funding cuts is immense, and we absolutely don't have the capacity to be able to step in fully for that gap.
Jean-Nicolas Armstrong Dangelser, thank you very much for coming on the show today.
Thank you.